Hello everyone, my name is Karen Bagumero and I'm from 4th year Bachelor's of Physiotherapy. So today I'm being given the topic Central Spinal Cord Syndrome and Management from PT Neuro. So when we talk about this Central Spinal Cord Syndrome, it is actually an injury to the spinal part or the central part of the spinal cord. So as we know for sure, as the anatomy may be, the spinal cord, it occurs around the neck area. So it's actually an injury to the central part of the spinal cord in the neck, which is the cervical spinal cord. So and it can cause weakness in the arms and sometimes in the leg as well. So and it is also this central spinal cord syndrome. It is also known as incomplete spinal cord injury. It can be due to a traumatic neck injury, and when damage occurs to the small bones, which is the vertebrae in the neck, it can also develop due to excessive pressure on the spinal cord. So probably if you want to probably if there is a traumatic event, probably like an accident, a road traffic accident, probably you might have like hyperextension of the neck. So it can actually be due to this central spinal cord injury. So and this spinal cord injury, this central spinal cord blocks this communication of the nerves between the brain and the part of the brain below the injury. So and it can affect the cortical spine tract, or the pathway to the spinal cord that carries nerve impulse to help you to be able to move. So which is telling you that if this central spinal cord syndrome, if it occurs, it can actually it can block the communication between the nerves to your brain. Yeah. So and the brain, as we all know, it sends communication to all the body, right? So it can, if there is this spinal cord injury syndrome, right, central spinal cord syndrome, if it occurs, right, it's like blocks the nerves to the brain and parts of the brain as well, and which can affect the cortical spinal tract and the pathway also to the spinal cord. So when we go over to the symptoms of this central spinal cord syndrome, one is aching, one is burning, one is numbness in the head, in the hand or arm, and difficulty in walking. As we have said earlier, that it can sometimes affect the leg as well. So there's definitely going to be difficulty in walking. There's going to be muscle spasm and causes, as I said earlier, hyperextension. When there's like hyperextension of the neck, when the trauma happens or during the traumatic event, that is one of the causes. And when we go over to the diagnosis, we can do CT scan, MRI, X-ray, electromyogram. And when we go over to the management, because it's also part of the question, we say we should talk about the central spinal cord syndrome and the management. So the non-surgical part is immobilization. The number one thing is immobilization. So we can use splints to help keep the arm, the hand in a very correct position. Or probably better still, as I said earlier, that it's also like there's difficulty in walking. So we can also give splints also, or probably orthosis. Yes, we can also give orthosis for the leg as well, to correct the leg as well, something. Yeah. So and then we go over to medication. We have steroids. They can use the patient can use steroids as well. And physical therapy, you know, like exercises to help the strength and the flexibility, and assistive device as well. So we go over to the occupational therapy more. From occupational therapy, we do modification to daily activities, and then surgery. And then when we talk about the complication, we have bladder problem, bowel problem, low blood pressure, breathing problem, blood clots in the veins, sudden high blood pressure, muscle spasm, and numbness and weakness. So that is just the overall of this spinal cord injury. Thank you.